Welcome to Live Doctors. Our program today is on asthma. I am your host for the program. My name is Dr. Kent Barchot. It's our privilege to be here with a specialist in allergy medicine, Dr. Stanley Fineman. Dr. Fineman, welcome to the program.
Thank you. Thanks for having me.
Dr. Fineman received his specialty training in allergy medicine, allergy disorders, through Harvard Medical School. Dr. Fineman, could you please give us a definition of what asthma is?
Well, asthma is an inflammatory disease that affects the airways. So when patients are suffering from asthma, which is usually triggered by an allergic problem, an allergic trigger, then what happens is that the airways are inflamed and they become twitchy, and they tend to close when they're exposed to the triggers, which include the allergies. When they close down, then people have trouble breathing. So when you have trouble breathing, then you get symptoms like coughing, like shortness of breath, wheezing, and those are some of the symptoms that you get from asthma.
And you as a doctor, when you examine a patient with asthma, what do you find on the physical examination?
Well, it's, first thing we do when we talk to patients with asthma is to find out what their symptoms are and what tends to trigger them. So the first thing is the history. The history that we get from the patient is very important. Some patients have their asthma triggered when they're running or doing activity. Some patients have their asthma triggered when they're infections, like have a respiratory infection or a cold. Some patients it's triggered by an allergen like their dog or a pet that they're exposed to, or smoke. A lot of people are triggered by smoke. So it depends on what's triggering their asthma. The other thing that's important about asthma is that it can be a hereditary condition. So frequently a patient who has asthma, their parents or their siblings might also have asthma or other allergy type conditions. So those are some of the things we look at first. The next thing, when we start to examine a patient, besides looking for signs of allergy, and a lot of times we'll see things like nasal congestion or allergic nasal disease, but then you listen to the lungs. So we use a stethoscope to listen to their breathing, to see the breathing pattern, and also to hear, sometimes we'll hear wheezing. Wheezing is usually a sign that the airways are closing. And when the airways close down, which is typical of asthma, then you get the whistle noise of a wheeze. And that's where we hear wheezing in asthma.